song of joy into my heart again. But when you take my hand, cause you let the sun shine in, and you make me feel so young again. I'm learning just to be like you, to take life as you do.
Hello and welcome to today's Know Your Fertility Wellness webinar. I'm John and I'll be your host for tonight. The webinar will begin shortly, so bear with me while I make some announcements. There will be a Q&A segment during the webinar where you may ask your fertility-related questions to the doctors from KKH and SGH. You receive a feedback form at the end of the webinar. Those who complete the feedback form will stand a chance to receive a Point of Care International goodie bag, each consisting of 8 ovulation test strips and 2 pregnancy test kits. So please do complete the feedback form for us. Terms and conditions apply. Sign up to receive one of the 150 fertility health checks or 50 TCM fertility consultations by sending in your details to www.ilovechildren.sg by 30th November 2020. Shortlisted couples will be contacted from the 1st of December 2020 onwards. Terms and conditions apply. If you're looking for peer support while trying to conceive, follow I Love Children's Facebook page and request to join Fertility Support Group Singapore. Ask anonymous questions and receive tips and advice from doctors. I Love Children is a voluntary welfare organization set up in 2005 with aspirations to keep Singapore young by advocating a higher priority to having children and educating couples on fertility wellness. They strive to be Singapore's one-stop portal for parenthood and fertility health, and where possible, provide support to couples with fertility challenges as well. Do follow them on Facebook and Instagram at I Love Children SG to keep updated on events, contests, and giveaways. And SG.funniest family videos on TikTok to brighten up your day. If you wish to donate to I Love Children, visit ilovechildren.sg and find out how you'll be eligible for 2.5 times of tax deduction. The Know Your Fertility Wellness 2020 event is organized by I Love Children, supported by Thomson Fertility Center, Thomson Chinese Medicine, Singapore General Hospital, KK Women's and Children's Hospital, and Asia PR Works, in support of Made for Families. Now, without further ado, I would like to introduce the guests that we have on the panel tonight. Are you ready? Over across the other end, we have, firstly, Dr. Andy Tan, a consultant with the Department of ONG in SGH.
Hi.
Next, we have Dr. Lily Kho, a consultant with the Department of ONG in KKH. And then we have Dr. Chua Kahi, a consultant with the Department of Reproductive Medicine at KKH. And finally, we have Dr. Serene Lim, a consultant at the SGH. Okay, so welcome, doctors, and thank you very much for joining us tonight. We did a fertility wellness poll online recently, and I'd like to share with you guys some of the results. So this poll was done online across Facebook, and I think many of the results were surprising, and I do fall into many of these fallacies as well. 33% of participants think that they need to try for less than 6 months before getting pregnant, while 37% think they need to try for at least a year. I also thought, I'm still trying, I'm still failing. And so I do want to say that I think within a year is something that I always thought that I'll be as well my whole life. And with my wife, we were very, very careful, even though we decided that when we get married, right, we were gonna spend a couple of years, just us, and then when we want to have baby, we're gonna like enjoy our single time first. And when time came and we first tried, I thought, I'm gonna be a daddy already. But it's been a year lah, It's been a year. The next one is that 81% of participants would consider undergoing assisted conception procedures, i.e., IUI. Well, that was very confusing. For example, IUI, IVF, if they have fertility challenges. And that's great. I mean, 81%, there used to be a stronger stigma, and growing up, to be honest, I myself have never considered or thought that I might require assisted conception procedures, but what I found out, at least this year, is that many of my friends already have. So that's very good. 50% of participants say that they would try to conceive naturally within a year before considering assisted conception procedures. Well, that's what I thought too, right? And so I spoke to the folks from I Love Children, and they told me that despite research surveys showing that 77% of couples want to have children within 3 years of marriage, like Moa, most couples that get married between the age of 28 to 35, the doctors shared that these couples usually only consult a doctor for fertility issues when they are 35 and above, most of them. So it's very strange. I would like to say that if I Love Children had not contacted me for fertility treatment, I honestly might not have. And now that I've done it, I do want to say that I'm very grateful for that, and that I've learned so much, and I realize how not easy it can be. And so I really encourage you guys to go as well. This echoes the doctor's observations that Singapore are seeking fertility health too late and has a direct impact on the success of natural conception and fertility treatments. So now, before we begin, we want to get to know all of you a little bit better. So I'd like to run a quick poll with those of you tuning in via Zoom. So in the next 30 seconds, do share your responses on the following questions. For those of you joining us from Facebook, I do want to say that the poll option is only available on Zoom, and so do bear with us, it'll just be a minute. And so, while we wait for our viewers to do this poll, I do want to ask the doctors we have here today, is there anything you guys want to say to the audience?
I would like to say good evening and welcome to tuning in here.
You're very cordial. Why like that? I thought we were going to keep it cash.
Yeah.
Okay, that's your casual already lah.
Yeah.
Okay. Dr. Lily, anything you want to say to the audience?
Hi to my dad and my sister who are watching.
And Dr. Chua.
This is my second time doing this, so thank you for having me, and nice to see everyone again.
Okay, so Dr. Chua is a little bit nervous. He shared with me just now, but we did a rehearsal, and actually he good lah. Handsome, can talk. Dr. Serene Lim, anything you want to say to the audience or anybody lah, for that matter? I realize now.
I'd like to thank everyone for spending their Friday night with us, and also to say hi to my kids, Sophie and Julian. Hello.
Do we have the results of the poll ready? Not yet. Okay, so I do want to say this, that I do wish all of you guys tuning in here that ask as many questions as you want. This is a very rare opportunity for you guys to have a panel of doctors to answer many of your fertility questions. Before this year, before the pandemic, this used to happen in a shopping center, and understandably, many of the questions you ask then might get awkward because you are not anonymous and everyone can see that you're there. So while the pandemic has forced us to make changes in life, I think it also brings us new and exciting opportunities. For example, right now where we can ask questions just behind the safety of our computers and ask away, okay? And I do want to say that many of these questions, and we are anticipating that many people are looking for a second opinion with these doctors. I do encourage you not to do that, I think, because it's very, very hard for the doctors themselves to give you proper advice, especially if they don't know your condition personally. So with that said, let me share the results of the poll. So of those of you tuning in, most of you are couples. In fact, 75% of you are couples and 37% are ladies, 6% men. Last week also like that, guys. How many of you here are trying for a baby? And that is 63%. That's great. 11% here is married with no children. 4% married with one child, and 19% just curious to find out more about fertility wellness. So I welcome all of you. How many of you here have gone for a fertility health check before? So 38% have gone for a check, and 62% have never gone for one. That's healthy, right? Is that what you're expecting? I was expecting 10%. How long do you think you need to try before getting pregnant? Most of you think within a year, 48%, or within 6 months, 26%. I also thought I was a one shot, one kill guy. I am not. And question number 5, if you have a child, how long did it take for you to get pregnant? 30% of you are still trying. Not applicable for 53% of you. 7% of you did it within 6 months. Oh, well done. So well here. Second child, got it. Would you consider undergoing assisted conception procedures if you have challenges trying to conceive? 84% of you said yes, and 16% said no. Once again, I'm very happy that this stigma has gone past us. Question number 7, how long will you try to conceive naturally before considering assisted conception procedures? The majority of you, which is 37%, said that you'll try for more than a year, and 28% within a year. Okay, is that the poll? So thank you very much for participating in our poll. Now that we know you guys a little bit better, I hope we can adjust our answers a little bit more for couples and probably expect more questions from the ladies as well. So we have first up Dr. Andy Tan from Singapore General Hospital. His broad topic is covering the do's and don'ts of baby making. And so Dr. Andy Tan, please take it away. My first question to you is, what's the optimal age to conceive naturally for both males and females?
Okay, and I mean, first of all, of course, that if you do have sexual intercourse and all that, I mean, the age, of course, is the factors. And if you do want to try to conceive, the earlier, of course, the earlier, the better. Of course, that, of course, if you don't have the chance to do it early, of course, you can still, try it. And while of course, anyone that has aging and process, of course, the eggs reserve will reduce for women, and of course the sperm as well will be bad for if we are older. So from this perspective viewpoint, of course, that the earlier the better. I mean, that's what I would suggest. And what the do's and don'ts that you need to do, of course, that
Is there though, sorry, just
Yeah.
to jump back a little bit. I mean,
Yeah.
earlier the better. I mean, all the doctors say that, right?
Yes.
But to be honest, is there a stage, especially in particular for women, right, whereby the rate of natural conception goes down starkly after a certain age?
I mean, I wouldn't say that you have a point that where the eggs will deplenish, and it will go on. I mean, whenever you grow older, it will, of course, it will become lesser, and then the quality of eggs also will go. So if you ask me when you should try to conceive, starting from the age of 20, 25, that you should try, because that apart from that, that you have to consider that risk of Down syndrome. Of course, the older that you conceive, the risk of Down syndrome also is higher. So, I mean, just from that factors itself.
Right. And
yeah.
how do you track ovulation, like the fertile window? That's something my wife and I have problems with as well.
Yeah. So, I mean, for those, I mean, I would not encourage. I mean, the first thing is I would say try to have sex as much as you can, and try not to stress yourself. And for those who really don't have the chance to meet each other that frequently, of course, then you have to come to a stage that, like you said, to try to do an ovulation kit.
Right, so you actually brought up a very good point, which I never thought of. You don't have to track your ovulation if you can.
Yeah.
Because tracking the ovulation does add up to like a lot of stress, like
Exactly.
mechanical sex and planned sex. It takes the passion out of it.
Exactly.
Right,
so, yeah. So, I mean, my advice to all of you, of course, that if you're trying to conceive, and ideally, after your period, of course, that your period is 7 days. After that, you should continue, and until, of course, that you suspect that you have ovulation and all that. Usually up to
suspect?
10. I mean, of course, that's something that you can think more of a mucus. Although I wouldn't encourage you to say, the change in the mucus or even the temperature surge and all that. I mean, that is because of the surge kit, which comes to the ovulation kit, which tests on the LH, I mean, luteinizing hormone. So I would not encourage that. But of course, what I'm trying to tell the couples that we have been trying one is try to have sex until, I mean, don't make the eggs wait for the sperm, in other words. So the sperm should come in, because sperm actually usually lasts up to a week, but egg will die off within 24 hours. Usually that's the thing. Yeah.
Right. So to maximize your chances, always have like sperm ready.
Yes, exactly.
How do you? So only this year at the ripe old age of 30, then I realized what is an ovulation strip. Like it only came into my radar this year. Can you explain first and foremost to viewers watching here that hopefully at least some of you also never heard of ovulation strip? What is it and how do we use it, I guess?
Okay, I mean, first of all, of course, I would say, unless that you really need it, I mean, you can do it. For example, you are long distance and you only meet once a month and all that. Then, of course, that will come handy that to test when you are really ovulation, then you have sex. But it's mainly actually is testing the hormone that when you ovulate, there's this the luteinizing hormone or called LH. There's a surge in so you can be tested in your urine. So that's when you say, oh, you should try for a pregnancy.
So if the ovulation kit tests positive, it means that
likely you have ovulated. So, and again, that is you have 24 hours, where as I explained to you, when there's LH surge, then that means that you are going to ovulate. So that is only when to test that you should start having sex, that kind of thing.
Sorry, I'm a bit confused.
Okay, so this is more of a physiology of the ovulation and all that. So in other words, that you need a hormone surge and all that to stimulate the egg to be produced. Right. Yeah.
So when the ovulation strip says it's positive, it means
likely you're going to ovulate.
I'm already in the window, or I'm going to ovulate.
Most likely that you're going to ovulate.
Going to. Yeah. Right. Okay. So if we pair that together with don't have the egg wait for the sperm, have the sperm ready for the egg, then I guess it means go time lah, right? Anyway, as far as fertility doctor go, every day is go time, right? That's what my doctor tell me as well. How do you optimize the chances of conception?
As I say again, I mean, of course, that try after your period, and then, in my opinion, you should not stress yourself. If you can, of course, I don't think everyone will try it daily, but of course, at least every alternate days or even every 2 days, that's statistics to shows that it's a very good chance of conception.
Not possible lah.
Exactly, which is what general conception will think that, oh, it's possible, it's too tired, all this added up stress and all that. So to be frank, of course, there's the studies and the data to say that those who does not have any contraceptions used within a year, a couple probably will get pregnant, 80% will get pregnant with this unprotected sex intercourse, yeah.
And on that note, a very serious question, right? If you do have intercourse every single day, will that be counterproductive, for example, with your sperm count depleting?
Okay, so this is a very good question. I don't think that your sperm will deplenish in that way, because that the sperm is produced every day for men, all right? Instead, like a woman, it's actually monthly due to ovulation and all that. So the thing is that you will not, yeah.
Right. Is there any things that we need to avoid during this?
Okay. So, I mean, coming to talk about this, I mean, if you, people will ask for what are the pre-pregnancy counseling and all that. Of course, what are the do's? If you do want to get pregnant, ideally, of course, you have good lifestyle. You should actually have, watch your weights, ideally a good BMI, I would say between 19 to 24. And of course, that you should not smoke. If you're already trying to get pregnant and all that, of course, you should not smoke, don't drink. And I mean, should have a healthy lifestyle, exercise and all that. Of course, that circumstances, if you do have pre-existing condition of a medical condition, you should optimize your medical condition before you try to get pregnant, yeah.
Right. I do have an important question that was on these notes. I do want to say it only because it's on these notes, but it really jumped at me. Components like saliva, does that kill sperm? Not my question, it's from the notes.
Okay, I mean, I'm not sure why is it that maybe for certain reason that why would the saliva, I mean, it's in this.
Because I mean, it's digestive enzymes, right? Does it?
Yeah, but I'm just saying that, I mean, you do have a usual section, because unless that you are saying that accidentally the saliva is there. But there's some studies, if you use the...
No lah, doctor, let's get real here. Some people use it as lubrication.
Lubrication, okay, I'm not aware, okay. So I mean, generally, if you feel that it's not enough of a lubrication and that matters, I think avoiding all this...
so you should avoid.
You should avoid, yeah. So there's some data shows that it can affect the motility of the sperm, yeah.
Okay, And one last question, I think, before we take up your entire 10 minutes, right? Is there a best or optimal sexual position to increase conception?
Okay, the answer is no. I mean, of course, you can try whichever the way that you feel comfortable with. And then, I mean, the question will come to why is it so? Because that you say the sperm will swim, is it, you know,
gravity lah.
yeah, the gravity. So actually, as I said, the sperm swim, all right? There's no position to say that even there's a woman is in an upright position and all that, it should happen even, yeah. That's
Why you awkward? So I guess what doctor is trying to say is that the best position is the position of the most pleasure that makes you want to do it again tomorrow. Correct?
yes.
Trying to get you to endorse that. So thank you very much, Dr. Andy. So next we have Dr. Lily. Are you ready? Dr. Lily is going to talk us through getting pregnant during the pandemic. Understandably, from my friends as well, I think many of them are holding off starting a family or getting pregnant during the pandemic because they are worried that it's hard to get an appointment or it's dangerous. Do we need to be worried?
Yeah, so first thing, I like to dispel that myth. Definitely not difficult to get an appointment to see us if you are pregnant, which is great.
Fantastic.
It's also safe to fall pregnant during the COVID situation. I guess in Singapore, things are very well controlled. Local transmission has been very low. There has been no fatality in terms of pregnant women catching COVID and dying from it. So that's very reassuring for people who are trying to fall pregnant out there. Yeah, so you should definitely not delay pregnancy. For healthy pregnant women, COVID hasn't increased the risk of things like miscarriage, early labor, even fetal anomalies. So meaning problems in terms of the development of organs in the baby. So that is all very, very reassuring.
Right.
Yeah.
And on that note, is it safe to visit hospitals throughout this time? I mean, I'm sure it is, your doctor, pointed question. But what are the precautions the hospital is taking during this time for families?
So there's a saying that says the most dangerous place is actually the safest place, right? So hospitals are really very safe at the moment because we take pride in terms of cleanliness. You know, the staff are obviously well equipped and trained with personal protective equipment. Of course, when people come in nowadays to see doctors, they have to go through the safe entry, temperature checking, as well as the online declaration form. So that actually is very important in terms of ensuring that everyone is safe in hospital. Patients that are high risk, so patients that are high risk of getting things like COVID, let's say we have a patient presenting with fever, cough, runny nose, or any of the symptoms that's concerning for COVID will be isolated immediately. So they are seen by specific doctors in full protective personal equipment. If they were to be warded, they would be transferred to the ward very carefully to avoid any contact with any other healthcare professionals or any other patients or visitors. And they would then be warded in the isolation ward in a single room and not allowed to have visitors until they are proven COVID negative. Right. So actually we have very, very tight work processes to ensure that the public is actually very safe from catching COVID.
Probably safer.
Yeah, in fact, I don't think that anyone has actually contracted COVID in KK. Any pregnant woman contracted COVID, touch wood. The processes are really watertight there.
Right.
Yeah.
And on that note of visitors, right, you mentioned if if my wife delivered during this period,
They'll be
can I have
pregnant.
visitors or not?
Visitors? Well, at the moment it's one visitor per patient.
Which normally is what?
That you can have, we don't normally advise that many visitors anyway.
Yeah.
But there are 5, in KK, the protocol is such, you can actually have 5 designated visitors, but only one visitor at every one time. Of course, going to high-risk areas like the special care nursery or to the labor ward or NICU, it's a baby ICU unit, is only one visitor. Right. So, we are still looking after the safety of our patients in that way.
And what are some of the precautions that I say we, my wife is pregnant, but what precautions do us and the viewers, what should we take when visiting the hospital, on our end?
So, I would say the general advice, so social distancing, wear your mask, hand hygiene regularly. The other thing is So, of course, we normally, like I said, we only advise one visitor per patient. So it'll normally be the patient and the husband coming for antenatal visit or seeing the doctor for their pregnancy. So try to avoid bringing your kids and your babies along as well. Yeah, if possible.
If possible. So, but your spouse can still accompany you
Yes,
for
of
these
course,
prenatal
definitely.
appointments.
And even to the labor room, that's permitted.
Right.
Yeah.
So there's this question that asks, I mean, it's kind of related to our earlier presentation as well, which is what are some of the do's and don'ts to consider when planning for pregnancy, especially during this pandemic?
Okay.
Okay.
So I mean, I think Dr. Tan has actually, also Andy has actually talked quite, mentioned a lot of the points.
Yeah.
But the other thing to add on would be preconceptional folic acid. So taking folic acid 3 months before getting pregnant. So those are the general kind of advice for people who are falling pregnant,
So
even
for people
outside
that's trying
pandemic.
to get pregnant, you should just be taking,
Yes.
I mean, just the wife, the woman, right?
Yes, yeah, of course, yes.
yeah.
But optimization of your health is very important. So for patients who have medical problems, it's very important to see a doctor, ensure that you are at the brink of health before trying to fall pregnant. Because as I mentioned earlier, that even though COVID actually does not significantly impact healthy pregnant women, of course, there are women with pre-existing health problems like diabetes, obesity, older women. They tend to be at increased risk of having more severe consequences relating to COVID. So I think optimization of your health before falling pregnant during this pandemic is pertinent and it's very important.
Do you see that during this pandemic that more people are getting pregnant? I see that.
Yes, I see that. I mean, we have definitely noticed that after the circuit breaker. I think the positive thing is people are probably less stressed, I guess, spending more time together at home, adopting healthy lifestyles. A lot of them are actually falling pregnant and coming on their own.
Right.
So even patients prior to this who have had difficulty conceiving, following the circuit breaker, they have been actually very successful in getting pregnant on their own without anything. So just regular sex again, I think
like
that's most
you're stabbing
important.
Okay. Sorry.
Yeah, I think
Should have more sex, lah. That's the point, lah, right?
more sex and less stress.
Which I also think that we should have a sexologist on this panel. Okay, next week. Tune in next week. I'm kidding. Sorry, please carry on. Any of the things, anything that we should not do anymore now that, or rather should do less of or take more precautions during this pandemic trying to get pregnant?
I mean, of course, avoid crowded areas. I mean, the general advice, right? So if you're pregnant, I'm not asking you to stay at home in your bubble, okay? But when you go out, adopt safe distancing, wash your hands regularly, wear your mask, just avoid crowded areas. Like instead of going shopping on a weekend, maybe do it on a weekday, something like that. Especially when you're pregnant, I think those general advice should apply.
Right.
Yeah.
I've heard rumors that people are spreading that using of like alcohol hand sanitizers, especially during this time where it seems so necessary that it affects like getting pregnant and affects a pregnancy.
Oh.
Is that true or not true?
Not true.
100% not
100% not true. It definitely doesn't affect. Definitely doesn't affect your chances of falling pregnant. And of course, it's very important to prevent you from getting even the common cold, flu, runny nose, and all that is very important, and doesn't affect your baby in any way. So please remember to wash your hands regularly. Yeah.
Okay. Thank you very much, Dr. Lily. Is there anything else you would like to add?
No, I'm good. Thank you.
You think about it.
Later. Thank you.
Okay, thank you very much. If you guys have any questions at this point for any of our doctors, right, do pop that Q&A button and ask it first. And then we'll get to it a little bit later. And so for topic 3, we have Dr. Chua, Mr. Chua, Dr. Chua. Are you less nervous now? You feel more comfortable?
Yeah, okay.
Dr. Chua is gonna bring us through the common causes of infertility for males and females.
Okay, so
what are they?
Yeah, so there are many causes. So for females, there is like one of the most common causes is ovulation problem. That's when the egg doesn't get released. Okay, you may have many eggs in the ovary, but it's not released. So
how do we know that, or how can women know that?
Oh yeah, so generally, if you have regular periods, then most of the time you are ovulating. However, if your periods are very irregular, they don't come every month, they may come every 2 months or 3 months, then probably you are not ovulating so frequently. Okay, so that's one. The other common cause is fallopian tube obstruction or blockage. So the fallopian tube is the transport pathway for the sperm to reach the egg. Okay, so There are two on one on each side, on the left and the right. So generally they are not blocked. However, certain conditions can cause them to be blocked. For example, previous pelvic infection, previous operations.
Or like cysts.
Or yeah, sometimes cysts or endometriosis. Endometriosis is a common cause. So if you have any of these conditions, or if you had previous...
Sorry, what's endometriosis?
Oh, endometriosis is a condition where some of the, to put it simply, is when the menstrual blood backflows. Instead of coming out, some of it backflows into the pelvis. So over there...
it forms a clump.
Oh,
is
yeah.
it the chocolate cyst?
Yes.
Okay.
So that's so it's chocolate cyst, so you know.
Okay,
so
sorry.
It collects in the tummy and then it forms endometriosis. It usually causes very painful periods now.
Right. But
so
does it mean that if you have a chocolate cyst or endometriosis that you need to go for treatment and get it out?
Well, definitely if you have endometriosis, you should get it treated. But it's not so straightforward that with a cyst, definitely you need surgery. So it depends on a lot of factors like how big is the cyst, and then what is the location? Is it one side or both sides? Because treatment sometimes has its own problems as well in terms of surgery. Okay, so you have to see a doctor. If you have an endometriotic cyst, the doctor will discuss with you the pros and cons of surgery. Okay, so these are another major cause is that of reduced ovarian reserve or reduced egg count in the ovary. So every woman is born with a certain number of eggs, and every month they will lose some eggs from ovulation. Okay, until menopause when they have no more eggs left.
Yeah.
So some patients have accelerated egg loss for whatever reason. For example, if they had ovarian cysts, or they had ovarian surgery, or they went for chemotherapy, for example.
Right.
Okay. Sometimes being exposed to toxins like smoking, excessive drinking can also reduce the egg count. Okay, so these are some of the major causes lah. And then nowadays, last time we always thought that fertility problems are mostly female. Nowadays, we realize that actually a lot of infertile couples have a male factor as well. So that is present in that's how we tell is the sperm count is low. Okay. You can suspect that by if you had a history of any testicular surgery, or you had undescended testes when you were young, the testis was in your tummy and it didn't go down. All these are causes lah. So,
right. But there's a surgery for that, right?
Oh yes, sir. Yes.
So if you had that surgery, does that then affect your chances, or?
It's hard to say. Right. Sometimes with the surgery, it can actually improve your sperm count or make it almost normal. Okay. Sometimes, despite the surgery, the sperm count can be very low or even nil. Okay. But a lot of these conditions are actually silent. So even though you don't have any symptoms, you have regular periods, you have no pain, you know, you're a very healthy adult male, you have no medical problems, you can still have any of these fertility problems if you don't check. Okay. So when is the best? So when is the best time to check? Yes. So if you are less than 35, and you have been trying for about a year, and then you don't get pregnant, you should check. Or if you are more than 35, then 6 months of not getting pregnant, then you should see a doctor. The reason is because when you are more than 35, naturally your fertility will be a bit less than when you were younger. Okay, and also you will tend to get more problems, for example, fibroids or ovarian cysts or endometriosis that younger women tend not to have. So as you get older, you tend to have more of these conditions, right. And you may not even know that you have them.
Right. So, I mean, I'm rather public with my life, and so I think I post on Instagram rather often that, oh, you know, we are trying for a baby and we are failing for a baby. I mean, it doesn't really affect me that much, but I just keep everyone updated about my life, right? And I mean, I have very, very nice people that would then tell me, or even my friends actually, most of them are my friends that would tell me, go on a holiday, go and de-stress, don't be so stressed. It's very hard when you're stressed. And does stress really affect conception? Because it's mental, right? It's like, yeah. Does it though?
I think so. I think a lot of the couples that are in the fertility clinic are very, very stressed, but it's really not within their control. It's something that you cannot really prepare for. It's not like you can study very hard for O-levels, for example. But this one is like, sometimes the harder you the more you think about it, the more stressed you are, and then the more it doesn't come, right? Okay, so how does it affect? So, okay, so sometimes when you're very stressed, the periods can actually go from regular to irregular. For example, when you have a major project coming up, or you're studying for exam, then suddenly you find that your menses doesn't come on time. So that's one, it affects your ovulation. And then also affects sexual performance. So especially there's a fertile window, there's a concept of a fertile window. So you're expected to have sex at that time. And if you miss it, then you have to waste another month, you know? So sometimes that—
Oh, I feel that stress. That stress is very real.
Yeah, so that takes the passion out of it. And you feel that a lot of guys have this problem when they do have this stress of having to have sex, then they can have sex quite naturally. But once it comes to that specific night, then they have problems doing. So it's actually quite common nowadays. So so the answer to that naturally would be to try not to be so stressed and exercise. So if you do exercise, healthy diet, your testosterone will naturally increase. That's your male hormone. And then it will increase your libido, your sex drive, and your sexual performance as well.
So the stress is not so much how you're feeling that day, but general life stress.
Yes. So it can, of course, how you're feeling that day will affect your performance on that day, right? So generally, life stress is it's very hard to dissociate in Singapore because we are all very busy and stressed. And we are as we marry later, our careers we are more successful, we are deeper in our career, so we'll be more stressed. So that's one thing. So because a lot of couples in Singapore, we tend to hold off our family and marriage while pursuing the career. So naturally, fertility as a whole in the population is lower compared to another population where people marry younger and get pregnant earlier. So sometimes when you can't get pregnant, even though there's nothing wrong with you, we do all the tests and everything is normal. So it's a large percentage of this called unexplained infertility. Sometimes it's just the mere fact that the female partner is a bit older, so it will cause the time to get pregnant to be a bit longer.
Right. And what is secondary infertility? What causes it?
Oh, secondary infertility is when you already have a child, you got pregnant and you have a child already, and then after that you find it very difficult to have one more. Okay. Right. So there's no one cause for secondary infertility. There's usually a multitude of causes. So one of the common cause is sometimes after childbirth, the woman's BMI will go up higher, and then that may cause some problems, such as it tends to cause the menses to become irregular, and it may affect ovulation. And as the BMI goes higher, the fertility is affected as well. It will drop. Yeah. So that's one of the main causes. Otherwise, we have to assess everything again to see what is the cause of secondary infertility.
Right.
But generally,
no, you go.
Yeah. Generally, as if a couple manage to get pregnant and deliver once, that's a very good indication that they can probably get pregnant and deliver another healthy baby again.
Right. You know? Do women that experience intense period cramps, right? Do they have cause for concern for infertility?
Oh yes. So people, patients with intense period cramps, they may be having conditions such as ovarian cysts or endometriosis, or growth in the womb, such as growth in the uterus, such as fibroids or adenomyosis. So it's best to get it checked. Okay. Right. So all these will contribute to infertility.
Are there treatments for men with low sperm count, for example, or poor morphology?
So low sperm count.
Can you explain morphology?
Oh,
Yo, getting ahead of myself, John. Attend one seminar, I want to explain things.
Okay, so low sperm count is so there are two different things. So low sperm count just means that they are expected to have a certain number of sperm in the ejaculate. So if it doesn't reach that number, then the count is low. Okay, so that is a real and major problem for the sperm. Okay, compared to morphology, it is when we look under the microscope, we see the shape of the sperm, and if it doesn't look good, then it is considered as low morphology. Okay, so this problem seems to be very widespread in Singapore and maybe in other countries as well, but certainly in our clinics. And initially we were wondering if that's really a problem, but a lot of the recent evidence says that actually it's not important. So
Right.
actually low morphology is not really important, and probably a majority of people have, and even people who get their wives pregnant, they may actually have low morphology as well, just that they didn't check, you know.
Right.
Okay, so
It's
how-
great to hear.
yeah.
Because I have low morphology.
Oh, okay, that's too much. But anyway, the low sperm count is really a problem. So unfortunately for the men to improve the sperm count, there are not so many treatment available. Okay,
Right.
because a lot of times it's not understood why there is low sperm count, but there is but to help with low sperm count, there are a variety of reproductive techniques or treatments such as IUI or IVF. In fact, IVF is very successful for treating low sperm counts.
Right. So I have one last question. Is it possible to get pregnant if you have fibroids?
So the answer to that is definitely yes. Okay, so because fibroids is so common, almost like 30% of women have fibroids. So if that causes infertility, then 30% of women can't get pregnant. But it actually depends
Right.
on the size and the location of the fibroid. So women in their 30s, generally the fibroids aren't so big because the fibroids grow with your age. So as you get older, they tend to get bigger. So women in their 30s, they may have fibroids, but generally are not so big. And they can very well get pregnant with the fibroid and carry a baby to full term with the fibroid and deliver.
Right. Okay, thank you very much, Dr. Chua. So at this point, I do want to say if you have any more questions for the doctors, do submit them in the Q&A. We'll try to address as many as we can later on. Next up, we have Dr. Serene Lim. Dr. Serene Lim is going to tell us more about the right time for fertility treatment. So Dr. Lim, Dr. Serene, Dr. Lim, Dr. Serene,
Serene Lim.
when should people consider fertility treatments and where can they actually go?
So I think for both men and women, there is a decline in fertility with age, more so for women than men. So I probably would encourage women who are a bit older to seek fertility advice a little bit earlier. But in general, if you're on the younger side, less than 35 years old, you can probably try for about a year before you start to seek a consult. Unless you think that you might have a problem that is affecting your fertility, like say fibroids or endometriosis, like what Dr. Chua has mentioned.
Right.
So we can assess fertility treatments in most hospitals in Singapore, but the public hospitals that offer fertility consults and treatment would be SGH, KK, as well as NUH.
What are the restrictions to fertility treatments, or are there any?
So previously in Singapore, there was an age restriction for IVF. So women above the age of 45 were not allowed to do IVF in Singapore. But from the start of this year, the government has lifted the age restriction such that you can potentially do IVF even at the age of 46 or 48 years old. So that being said, I wouldn't encourage you to seek, fertility help at the age of 45. So probably still the earlier, the better, if you can.
Right. So for those of our viewers that didn't join us last week or don't know yet, can you give us a layman understanding or layman explanation on what's IUI and what's IVF?
So IUI is what we call intrauterine insemination or artificial insemination. So what it means is that we'll usually give you some medications to help the woman to ovulate or to boost her ovulation if she's already ovulating regularly. And then during the time of ovulation, we'll get the man to produce a sperm sample. The sperm is washed in the lab to enhance the motility of the sperm as well as the quality of the sperm. And on the same day, we'll put this sperm in the womb. So this procedure is actually quite similar to what a woman goes through for a pap smear, for example. And it's probably more natural in that sense because the fertilization, the sperm and the egg still meets in the body, in the tube.
Right. So that's IUI.
That's
and then
IUI, yes.
IVF?
So for for IVF, or what we call in vitro fertilization is quite different. For IVF, usually what we'll do is that we'll give the woman hormones. The hormones are exactly what you produce in your natural cycle. So in your natural cycle, at the start of your natural cycle, your brain produces signaling hormones that tell the ovaries to make mature eggs. So the hormones that we give you for IVF are exactly the same. So usually for most women, we'll give either a 2-week or 4-week course of hormones to tell the ovaries to make mature eggs. And during that time, the woman will probably have to come into the center to be scanned or do some blood tests, probably about 4 to 5 times. Okay. And when we think that, the eggs are good to collect, usually what we'll do is that we'll do a procedure to collect the eggs or an egg retrieval. So this is not surgery. Usually the procedure is done entirely vaginally. You can go home on the same day. In SGH, usually we'll give the woman some light sedation, and for most women, it's quite a pain-free kind of procedure. All right. So after the eggs are collected on the same day, usually we'll get the husband to produce a fresh sperm sample, and then we'll do the fertilization. So the eggs and the sperm meet in the laboratory, and after that, the embryos are put back into the uterus or in the woman's womb for a couple of days after that. So the embryo, what we call, the procedure is called an embryo transfer, and it's also something similar to what a woman goes through during a pap smear.
Right. So for couples that would like to prepare themselves before embarking on fertility treatment, what can they do to prepare themselves? I mean, physically and very importantly, emotionally, what will you advise your friends?
So I think the usual advice would be for guys, for both men and women, smoking is bad for fertility. So I will encourage you to quit smoking, or at least cut down on smoking if you are embarking on trying to get pregnant. Probably, I think it wouldn't be helpful to stop smoking, like say 2 weeks before you start IVF, because for most men, okay, they do take about 2.5 months to make sperm. So whatever you do within 2 weeks wouldn't make an impact on your sperm at all. So you need to quit smoking at least 3 months before you start IVF or IUI. The other thing that I would encourage couples to do would be to optimize their weight. So this especially so for the woman, because the fertility medications, okay, are absorbed by the fat. So the higher your body fat, the more of these fertility medications will reach your fat, where we don't want the effects to be. Yeah, we want the fertility medications to go straight to your ovaries to have an effect on the ovaries. So probably before embarking on IVF or while waiting to do IVF, I think it might be good to reduce a bit of your body weight or try to optimize your body weight before you start IVF. And if you do get pregnant with IVF, optimizing your weight can also help to reduce risk during pregnancy. So I think the usual advice will also be I will usually encourage my couples to eat well and also reduce stress before embarking on IVF. So probably, I think a diet that is rich in antioxidants, fruits and vegetables, okay, might be good to promote eggs and sperm quality. And I think the other thing I would advise is, it doesn't mean that if you're going to start IVF, you won't be able to conceive naturally. I think it's still important to, keep trying. And who knows, you might end up getting pregnant naturally, the month before you start IVF, for example. Right. So I think for couples who, have plans to start IVF, it's still important to continue trying naturally, because we do have some couples who luckily got pregnant the month before they start IVF, and wow, you save yourself quite a lot of money in that sense.
Do you though? Got deposit one or not? So on the note of emotionally preparing yourself, right? What is the success rate for fertility treatments?
So the success rates do go down with the woman's age. So I think if you are closer to 30 than 40, probably the chance of getting pregnant per IVF cycle would be about 40 and maybe even 50%. Once you reach the age of 35, you'll probably have a 30% chance of getting pregnant, and closer to 40, the chances of success would be about 10 to 20%. For IUI, it's also a similar story. So the older you are, the chances of getting pregnant do go down. So closer to 30 years old, you have a 15% chance of getting pregnant through one IUI cycle. And 35, it will be about 10%, and closer to 40, it will be probably about 5% per cycle. So I think in general, I'll tell my patients that the success rates for 3 cycles of IUI would equate to about 1 cycle of IVF. So I think IVF, although it's more expensive, it's more invasive, it does involve more medications, it's probably more efficient for getting pregnant than compared to IUI. Yeah.
Right.
So probably I think the older you are, the more we'll recommend for the couple to do IVF rather than IUI.
Okay, thank you very much for sharing that. I mean, I think then that leads me to the most important question on everyone's mind. How much do they cost? Or range, not range?
So IUI is much cheaper compared to IVF. The cost of IUI can range from about $1,000 to up to $2,500, depending on what medications we use. The cost of IVF is about $12,000 to $16,000 per cycle.
Wow.
So in Singapore, if you are a Singaporean, or if one of the couple is a Singaporean citizen, and the woman is less than 40 years old, they do get, the government does give you co-funding for both IUI and IVF. So the government gives co-funding for up to 6 cycles, 3 fresh as well as 3 frozen IVF cycles of up to $7,700 per couple. And this is on top of the Medisave that you can pay for IVF. So for IUI, the government gives you additional funding as well. And this can be up to about $1,000 per cycle. So you can access this information in detail on the Ministry of Health website. So we have provided the QR code for your convenience.
What's the difference here between the fresh and frozen?
So the fresh cycle is the cycle where the woman gets injections for her to for us to collect mature eggs from her and to make the embryos or the fertilized eggs. So the fresh cycle is the one where the woman needs to go through injections for us to get to make embryos from her. So there are couples who are lucky enough to have excess embryos, additional extra embryos that are created from the fresh cycle after the fresh embryo transfer. And then for these couples, we usually encourage them to freeze their embryos and come back for the frozen cycle. So if you notice the cost of the frozen cycle is usually much cheaper than the fresh cycle, because for the frozen cycle, you usually don't need, usually what you need to do is to give you some medications to prepare the lining. So you don't really need lots of injections for the frozen cycle. It's much cheaper and also probably less daunting for the woman.
All right, thank you very much, Dr. Serene. So right now, I'd like to open up the floor for Q&A. If you have a fertility-related questions to ask our experts, then please feel free to type them out and then send them over. While we wait for the questions to come in, I'd like to ask the doctors once again. Oh, I didn't prepare you for this one. Now, in your capacity, I did. In your capacity as a parent or a friend to couples, right? What advice would you give for couples trying for a baby? Not medical one, not medical one.
From me, again, I would say that I do really have friends to ask me, say that, oh, how...
Free advice, right?
Yeah, say, and how do you get pregnant and all that. And again, I say, reduce stress, like we've been saying, that, well, stress, does it really cause the problem of infertility? Somehow, of course, it does. So I think that after reducing stress, enjoy sex, then eventually, of course, after trying like up to a year, as we all mentioned, depending how old you are, of course, that the older you are, should not try too long and all that. But if you are relatively young, at least up to a year, trying that should help you with getting a conception. Yeah.
Right. And Dr. Lily?
Yeah, I mean, actually, I think the most important thing is just to have regular sex and not to stress yourself and bore yourself down with, doing ovulation kits, checking your time, checking your temperature. I mean, you can, but I think it just adds on more stress to people.
Yeah, there's the daily stress of life that already affects you, and then the stress of trying to get pregnant is actually magnified.
Yes, exactly. And I mean, working in Singapore, we all have a very, very busy schedule. So on top of that, you still have to check your temperature, check your cervical mucus, use money, buy the ovulation kit. I just tell my patients, or my friends rather, just to have regular sex, especially when the woman is having a very regular menses. Just have regular intercourse every 2 to 3 days when you're not menstruating. And most of the time, people will fall pregnant. Yeah. No, pointless menstruating.
I mean, not just that lah. But okay, thank you very much.
Yes.
Dr. Chua.
Or I would say that for couples to spend more quality time together, go to do things that they like. For example, go to the park, go and watch a movie, or book a holiday. You know.
Work on the relationship as
Yeah.
well.
So when you have that, and then intimacy will come naturally, right? So then you have more sex, and then hopefully you get pregnant faster.
And Dr. Serene?
Yeah, actually, I have a few points to make. So, I think from my experience, I think a lot of couples, they don't. I mean, everybody knows that, you know, you have to have sex during ovulation for you to get pregnant. But I think what many people don't realize is that there are studies that show that most pregnancies are conceived if the couple has sex within the 5 days before ovulation. So, for example, if you have a regular 28-day cycle, you're probably ovulating on day 14. And you probably should start having sex probably about day 8 to 9 of the cycle in order to maximize the chances of pregnancy that cycle. Yeah.
Day 9 of the cycle, day 9 is...
So day 1
after
meaning the first day
menstruation.
of, day 1 meaning the first day of your full flow.
Right.
Yeah, so day 9 would be day 9 of your cycle. Yeah.
After your menses.
After your menses, just
Not practical, doctor. Not practical. Not try.
probably you should try it. It's that.
Yeah, you might
okay.
thank us for
Okay,
it.
moving on. We now have a lot of questions. So are you ready? Dr. Andy Tan, we have a question for you. My wife feels excruciating pain when we have sex. How can we achieve successful intercourse to get pregnant?
Okay, so first of all, I think if you do have what we call that a term called dyspareunia, you have pain during sexual intercourse, I think that you should get a check on the gynecologist, because it can be a few reasons. Of course, that if it's really a few factors you need to find out. If it's what we call superficial pain, it can be due to what we call a condition that you can't receive sexual intercourse, that's called vaginismus. And sometimes you have pelvic floor allodynia, that's actually because of the pain, the muscle tone and all that, of course. And the other thing is, earlier on, I think Dr. Chua mentioned, is actually endometriosis. It can be quite significant. And other things can be also due to previous pelvic inflammatory disease. So you do have pain during sexual intercourse, I think you should seek your help from a gynecologist and to find out what's the reason, and then to go on from there, yeah.
Jumping back to Dr. Serene, she was telling me earlier that she has an app that she wanted to recommend to people. do you wanna? She showed me the app. It's pretty good.
Yeah. So actually, Sing Health, so KK and SGH, we are part of the Sing Health family of hospitals. So I'd like to recommend some further material that you can access online just to reinforce what we have said during this webinar. So can you show some of the slides, please?
What's the name of the app first so people can download while waiting?
Yeah, so it's actually called so I would like to talk about one of the fertility pamphlets that we have produced in our hospital. So you can access the pamphlet from the QR code. Sing Health has also what we call a Health Buddy app that is quite convenient, not just for accessing information about your health, but also for making appointments, etc. Can we go to the next slide? So just to help you to navigate around this app, it's probably a little bit tricky to use in terms of finding the information that you want. So if you like to find out more about fertility, pregnancy, or any gynecological condition, just go to conditions and treatment and click on the button at the bottom of the body and click on uterus, and you can then what pops up would be a whole list of conditions that you can get advice and further information about. So things about IVF, infertility, ovarian hyperstimulation, endometriosis, etc., as well as information about what to eat when you're pregnant, pregnancy diet, exercise during pregnancy, etc.
Okay, thank you very much. Okay, we have another question here. This one's directed to Andy Tan. Dr. Andy Tan, are you? Just Andy Tan, you are.
Yeah, okay, thank you for the question.
Audacity.
Yes.
This one's for Dr. Andy Tan, but I guess it's open to anyone as well. Are there any food or drinks to avoid while trying to conceive?
As I think, again, I mean, every one of us
Alcohol,
yeah, avoid alcohol, avoid smoking. I think just to have a balanced diet, I think that we should emphasize. And I mean, some of course will worry whether in case that you get pregnant, the thing that you should avoid is that probably raw food. I mean, the chances of getting a condition called toxoplasmosis is there if you eat raw food, raw fish, and all that. So, and yeah, probably I would just say that, yeah.
There is, I have a lot of people that recommend going like drink some red wine or even dom or yomeishu.
And so again,
which contradicts that whole no alcohol thing, right?
Yeah. So I mean, the thing that we worry about alcohol is that if you have excessive alcohol, that you worry when you have the pregnancy, the baby, the condition is called fetal alcohol syndrome. So there's a condition that where it affects the baby development and all that. So, I mean, there's no guideline to say what is the safe limit for you if you are pregnant to get a safe unit of alcohol. But generally, if you do get 1 unit of alcohol a week, but there's no I mean, evidence to say which one is safe. So if you really want to try and get pregnant, my advice would be just avoid alcohol. I mean, it's good, yeah.
We have another question. Does supplements improve fertility for males and females? And does taking prenatal vitamins regulate ovulation?
So actually, no, I don't think taking vitamins will help you to ovulate. I think the effect of supplements on fertility is quite controversial. We have couples that, try supplements that are high in antioxidants. Some of them do conceive, but the evidence not too clear whether taking supplements do make a difference in getting you that baby. And most of these supplements are quite expensive. And in addition, I think most of the vitamins in the supplements, the antioxidants in the supplements can be obtained just by eating a healthy diet, like eating lots of fruits and vegetables.
Right. So there are no specific vitamins or supplements that improves fertility, for example. It's more of just improving your general health.
Yeah, that's right. I mean, I don't think there's like a magic diet for fertility, unfortunately. Yeah. There's no harm in taking them, but if you don't take them, I don't think you will lose out in that sense.
Right. This is a great question. We have a very, very good question. What kind of lubrication is suitable for couples trying to conceive? Like, for example, I just found out today that saliva not just doesn't help, it's bad. Is there one that's...
Actually, there are a lot of lubricants on the market. So, majority of them are water-based. So, they are composed of mainly water. So, it's found to have maybe a detrimental effect, just like saliva. So, it can make the sperm swim actually slower, reduce the motility. So, oil-based lubricants are better. So there are some sold in the pharmacy, like for example, the brand is called Pre-Seed. So these are oil-based lubricants, which actually does not affect the motility. So if you are trying for a baby, then you may want to consider using some of these.
Right. And is it advisable to avoid doing vigorous exercise before ovulation if we're trying to conceive?
I don't think there's any evidence for that, actually. I mean,
sorry.
I think that the most important thing is just regular exercise. Whatever you normally do and whatever you're comfortable with.
Right. So even if it's jumping, even if it's HIIT.
No, it doesn't matter. Yeah, it's actually safe. And I think exercise is very, very important, in ensuring a healthy BMI, important for your emotional well-being and all that, your mental well-being. So it doesn't really actually matter what kind of exercise you do before ovulation.
Right.
Yeah.
I have a question for, I think, Dr. Serene here, which I think it's a good question. What are the tests involved in a fertility health check?
So for the men, the most basic test would be just to get a sperm test. For the women are more complex. So usually we advise the woman, in our center, usually we advise the woman to do a blood test or a scan to check the egg count. We also do advise a scan to check whether there are any structural problems in the womb or in the ovaries, like an ovarian cyst or a fibroid. And then usually we also recommend to do a tube test as well to see whether the tubes are blocked.
Right. So for my wife and I, my wife had to do a blood test, and what's that? That scope thingy to kind of
like a keyhole, a laparoscopy.
That I don't know. I will not attempt to pronounce that. But for the guy, you just kind of produce your sample. So I don't know. What I learned about it is that many guys feel very apprehensive to go for a fertility check because they're embarrassed for some reasons. I cannot figure out why, and I don't understand why you would. So please go and do it. We have a question here for, I think, Dr. Andy Tan again. Is implantation bleeding common?
Implantation bleeding. So if I get it correctly, the question would be if you do get pregnant and then you have bleeding. Is that right?
Well, that's the question. Yeah.
Because
So
if
you're
you
putting me
ask,
on the
I mean,
spot here.
yeah, and I mean, if it, I mean, it's implantation bleeding, I would take it as that. If,
Sorry, meaning what? Can you explain that
okay,
again?
so if you do, it's a question of whether if you already implanted. That means, for example, if embryo transfer is implanted,
Yeah.
I don't think you will say it as implantation bleeding. If it's you put it as bleeding during your pregnancy, we will call it. Usually, the term is called threatened miscarriage. I mean, there's small risk associated that if you have bleeding during the first trimester, that's a small gestational age. In other words, that the baby's weight will be affected and all that. There's some evidence on that. But how it progresses actually really depends on the first trimester. So that up to 20% the couple, if they do get pregnant, sometimes they do get miscarriage, and most of the time that it's the causes are unknown. Of course, it can be still due to the fetal anomalies and the Down syndrome and etc. and all that. So yeah, I hope that answered the question. Yeah.
I hope that answers your question. We have another question here, which is it possible to start Clomid without undergoing fertility testing? We have Dr. Serene. Can you first tell us what's Clomid?
So Clomid is a medication. It's a tablet that sends signals to the brain to increase the signaling to the ovaries to help you to ovulate.
Right.
Well, I think in general, it's not wrong to start to give the patient a trial of Clomid for a couple of months, but if you don't get pregnant after trying with Clomid, I think it's probably advisable for you to complete the fertility checkup. I think for couples who are a bit on the older side, or if you think that the man might have a problem with his sperm, it's probably better to get yourself checked early so that if there are any problems that are identified, you can get them sorted out early rather than wasting time on trying Clomid without any success. So for example, if the tubes are blocked, taking Clomid won't help you to get pregnant because the sperm and the egg meet in the tube. So even if Clomid helps you to get your egg out, the sperm and the egg won't meet because your tubes are blocked. Or for example, if the man has poor sperm, it's very unlikely that, even with ovulation with Clomid, the sperm is unlikely to reach the egg easily. And you probably would have to try something like a fertility treatment on top of Clomid.
Is Clomid available over the counter?
No, it's not.
Right. Okay. So there's this question I just now asked already, but I have you ask again. Should the lady elevate her legs after intercourse to encourage sperm to swim with the help of gravity? See, it makes sense. It's a thing, guys.
Okay, I've answered that question. Maybe we'll ask.
Yeah. We ask someone that will give us some more, a little bit more science on that one. My understanding of it was that your sperm swim around the liquid, right? And so within an elevated angle, flow the liquid there, giving the sperm the opportunity to then swim there.
Unfortunately, this is the.
Am I talking rubbish?
Okay, unfortunately, there's a misconception. Of course, you think that by elevating and allowing to swim, into your body and all that. But as again, the sperm motility is the most important, and the seminal fluids is just a medium for the sperm to go into the body, and that. In fact, that orgasm, actually all this, that the contraction would help the sperm to swim a little further. So the position itself, again, as I say, the position, having sexual intercourse and all that, it doesn't matter. Yeah.
So right after intercourse, it's going.
Yeah, if you go for loo, you go for a clean, it should not, it will not decrease the change. Yeah.
Right. On the topic of loo, we have a question from someone that asks, does irritable bowel syndrome affect pregnancy? Should they address to Dr. Lily?
Sorry, what was the question?
Does irritable bowel syndrome affect pregnancy?
It shouldn't actually. not to my knowledge. I mean, it's not a condition that actually affects your, how to say, in terms of your diet wise and all that. It shouldn't affect. I mean, and people would have, unlike other conditions, for example, things like inflammatory bowel disease, like ulcerative colitis, or Crohn's disease. So these are very, very severe inflammation of the gut where it actually affects the absorption of nutrients. And of course, that can affect the pregnancy itself.
Right.
But conditions like irritable bowel syndrome shouldn't affect pregnancy at all. Yeah.
Adding on to that, does asthma affect fertility or the fetus?
Asthma shouldn't affect your fertility. If you've got well-controlled asthma, it wouldn't affect your fertility. But of course, when you are pregnant with asthma, that is very important to highlight to the doctor that you're seeing, because about 1/3 of people with asthma can actually have worsening of their asthma while they are pregnant. So it's very, very important, that we optimize your health and your medications that you're on while you are pregnant. And of course, if you are smoking and asthmatic at the same time, please stop smoking, because smoking will make your asthma worse as well.
Yeah.
And affect your
At
pregnancy.
the end of the day, a lot of it is about really taking care of your body in general, right? Because when
Yeah.
you are healthy, you are
Correct.
better for
Yes.
fertility. So we haven't heard from Dr. Chua in a while. Dr. Chua, we have a question for you. Are my chances of ovulation reduced if one of my ovaries is smaller than the other?
Firstly, how do you know your ovary is smaller than the other?
That's a great question.
Yeah, so actually the ovaries are,
Throwback Q&A.
so actually the ovaries are, the size is not really reliable because the size actually changes depending on whether you have cysts, ovarian cysts. But the ovarian cysts do tend to come and go with the cycle. So it's not really easy to tell what your ovarian size is. So I think the answer has to be no scientifically. But anyway, the way to tell ovulation is really your cycle, your period, how regular it is. So if it's very regular, most likely, majority of the time you are ovulating normally. If you don't have regular periods, it takes about 2 months, 3 months to come once, then most likely you are not ovulating.
Right. And when you try to conceive, when can you try to conceive again after having one fallopian tube removed due to ectopic pregnancy? What's an ectopic pregnancy?
Okay. So an ectopic pregnancy is when the pregnancy is not in the usual position, which is the womb. So it's outside of the womb. And this often happens in the fallopian tube. So the treatment for that is to, one of the treatments is to remove the tube. Okay, so to do that, you have to do an operation. Okay, so usually people, usually we give about, expect about a month of leave for the patient to recover. And then usually by 1 or 2 months, 2 or 3 months, the menstrual cycle will have resumed back to normal. And that's when you can start trying again. So, okay, so of course, provided you feel well from the surgery, you don't have any other after effects like pain or anything else from the surgery, then actually it's quite safe to try after 2 or 3 months.
Okay. The next question is, how soon after stopping contraceptives can we try for a baby? I'm guessing oral contraceptives. Dr.
Yeah.
Andy, I guess.
Okay. So I would say that as long as that you stop the contraception, your period will happen, and then within a week, actually, without the contraception, there's a chance that you will ovulate. So the same goes to if you have missed pills and all that. So the answer to that is actually as long as you stop your contraception, it should not affect your fertility, and you should have your ovulation will resume.
Right. So taking oral contraceptions does not affect your fertility health in the long term.
No.
Okay. How do I track ovulation with PCOS? And how can I increase chances of conception? Sorry, so that's one question. How do you track ovulation with PCOS?
How do you track ovulation in PCOS?
First of all, what's PCOS?
Okay, PCOS is a condition that's where you don't have a regular period, okay, and then the diagnosis actually is made by a diagnosis exclusion, and you do need to have hormonal tests to rule out the other condition, and then to have ultrasound pelvis to look at ovaries that have just called polycystic ovary. All right, so that's a condition, and then you have irregular period, usually less than 3 or 4 cycles a year. So that's a condition of PCOS. So it's I would say it's pretty difficult to track your ovulation if you do have PCOS. And then what option can be done, of course, that is to have a consumption of progesterone to induce the period. That may give you an effect of period, and then you can track from there. So yeah, the answer to that is that's why PCOS condition people have more difficulty to getting pregnant. So yeah.
Right. So see a doctor lah.
Yeah.
Okay. So this is a very tough one. I'll try my best. Okay. Can you get pregnant with teratozoospermia? How close am I to getting that right? Or do you not know what I'm talking about?
So teratozoospermia, you got it right. So it is actually the diagnosis of on the semen analysis, on the sperm test. So there is a parameter which says morphology. So teratozoospermia is a medical term for low morphology. Okay, so as I explained earlier that actually this is very, very common. We're not sure exactly why, but it does not seem to affect pregnancy. So a sperm test that comes back as teratozoospermia only, with only low morphology and nothing else abnormal, we classify it as essentially normal and no problems.
Right. I repeated this story last week. I mean, I said this story last week, but I'll repeat it again. When I went for my fertility checkup and I got the report, all of my indicators were normal or optimal, except morphology as well. So it feels like a kick in the gut when you see that report, right? And then there's one that is very low. But then the doctor said, I also like that. I got 3 kids. So that was very reassuring. I have a next question. I suffered a blighted ovum in January. Are you all following? Blighted ovum. I suffered a blighted ovum in January and I'm still trying to conceive. Should I go for a fertility check or continue trying naturally? Very pointed. You ask them, they should ask you to check. But does she have cause for concern?
I mean, I feel that it really depends on the person who's asking the question. So there are a lot of factors that would affect your chances of fertility. So, i.e. the age of this person, does this person have any long-term medical problems? What's the menses like? Is it like a regular menses that shows that likely that you are ovulating? Is there any other potential problems, like, for example, a male factor, as what Dr. Chua has mentioned? So in the absence of all these, I guess you can continue to try again. But I would say if you want to be reassured, it'll be good to see a gynecologist who can then assess you to see what are your chances of achieving a natural pregnancy after the blighted ovum. Yeah.
Right. Dr. Andy Tan, we have a question for you again. How do you check for endometriosis for retroverted uterus?
Okay, so I believe that probably you have seen the doctors, otherwise you wouldn't know what is a retroverted uterus. Okay, in other words, actually the uterus is tilted behind. Okay, in my opinion, I think the uterus position is not important. It's like you being a left-hander or right-hander. But if you do have endometriosis that's consistent with the history, for example, severe dysmenorrhea, which is a painful period every cycle, and you can couple with painful sexual intercourse, and even you have pain during your bowel opening with some symptoms and all that. Yes, so the retroverted uterus can suggest that you have deep endometriosis, which can be eating into the bowel. So yeah, then you probably need to address on that. Yeah.
Okay. We have another question, and I think this one stems from probably frustration and confusion. Is it possible to have a positive on ovulation kit, but not actually ovulating?
So actually, that is possible because there are actually many ways to check for ovulation. I would say the most accurate would probably be a blood test. Okay, so
wow, serious.
Yeah, so the urine ovulation test kits they are quite good because they're easy to use and everything, but they may not be very, very accurate. Okay, so sometimes a lot of times there's either it's positive when it's not. or when it's negative when you're actually ovulating. So some patients do experience that, and then they get very confused by it. So actually the most accurate way would be a blood test to check for ovulation.
Okay, blood test. You still see whether you still want to check or not. We have a question for Dr. Lily Kho. Will breastfeeding affect ovulation? I'm guessing it's a second child.
Well, I guess if you're actually breastfeeding, you shouldn't, I mean, if you're fully breastfeeding, i.e. breastfeeding very, very regularly, most people do not actually shouldn't ovulate. But that form, some people use it as a form of contraception actually. So it's effective as a form of contraception. So in people who have delivered, they breastfeed regularly, and they do not have their menses, okay? That contraception efficacy-wise is about 75%. But that also means that in 25% of cases, people may accidentally fall pregnant. Yes, so yes, breastfeeding does affect your ovulation, but it does not prevent ovulation totally. Yeah.
I got one more question for you,
Yes.
and I have this question for myself as well. Are there any differences in ward accommodation arrangements during the pandemic? For example, the 6-bedder become 4-bedder, and you 2-bedder, you get a free upgrade. I paraphrased it for myself also.
No, actually.
Really?
No. So
Okay.
yeah, I mean, the accommodation is still the same. And the reason is because we actually isolate all our high-risk patients in the isolation area in the ward. So these patients get a free room. Yeah, single room, if that's what you want.
Sorry, I missed it. How to get free room?
Be isolated, so be high risk.
Never mind.
You subject yourself to the COVID swab as well, yeah?
Okay, we have another question. What's the estimated duration for IVF treatment? Or rather, how many sessions and treatments need to be done for IVF?
So
Serene?
I think nowadays, most IVF clinicians would probably do like a short cycle. That means of about 2 weeks of injections. But there are some patients that potentially need a long cycle, which is about 4 weeks of injections. So it really depends on your medical condition or your fertility factors. Yeah. So, but I think majority of centers are doing like a 2-week kind of cycle.
So 2 weeks is that process?
About 2 weeks of injections before you go in for your egg collection.
And for IUI, I understood when you mentioned earlier, it's a day thing.
Yeah, actually the IVFs and IUIs are both day things. So the egg collections, the IUI insemination, as well as the embryo transfers, they are all done as kind of day procedures. You don't have to be admitted for them at all.
Okay. For Dr. Chua, is there any way to improve implantation? I don't fully understand this question. I hope you do.
Okay. I think implantation you refer to when you have we are undergoing IVF, and then the last step where we take the embryo and insert into the womb. So after you put it inside there, and then the embryo will find its own way, and then into the womb lining, and then implant, and then hopefully develop into a baby. Okay, so it is a very difficult question to answer. So because a lot of times, once we put the embryo in, it is not within our control anymore. Of course, we have to make sure before we put the embryo in that all the factors are optimal. For example, the womb lining, the thickness of the womb lining, whether there's any polyps or fibroid that is actually affecting the structure of the womb lining. So all these will have to be assessed and treated before we even do the embryo transfer. So actually, after the conditions are optimal, and then to actually improve implantation is not such it's a question that many clinicians are all over the world are asking ourselves. There are many ways that people try to do to help. For example, something called an endo scratch, where we do put a small instrument in to cause a bit of injury in the hope that it will make the lining more sticky, for example, more sticky. Right. Or some infusion of something called a medicine called intralipid, which may help to improve implantation. But nothing seems to work for everybody. Okay, so all these procedures, some of them may work for some small groups of patients, but there is no real treatment at the moment that works for everybody to improve implantation. And a lot of research is going into this field to find out more about it.
Thank you very much. I have another word that I might butcher. Okay, I try my best here. Listen closely. This one is the hardest one yet. I have thrombocytopenia. Yeah? Any precautions to take for pregnant ladies? Maybe Dr. Lily?
So I think to answer the question, first thing is we need more information. So thrombocytopenia basically means
Oh, you said it so easily. Sorry, please carry on.
yeah, so thrombocytopenia basically means a low platelet count. And platelets are very, very important in our body. It's one of the proteins in our blood that helps us to clot. So when people have thrombocytopenia, they have a tendency to bleed because they cannot clot. So there are many, many causes for thrombocytopenia. Some more benign, meaning more mild, doesn't really affect the pregnancy. Some more severe. Okay. So the first question I would like to ask this person, or we want to know more, is what is the cause of the thrombocytopenia? Okay, because there's many, many reasons why one would have a low platelet count. Okay, so things like viral illnesses, like if you were to have dengue, or you may have like a very bad flu, you might have a low platelet count. So it could also be something very, very significant. So like ITP, all that is due to your own body is attacking platelets itself. So that is definitely more significant, and people tend to be on medications for those as well. So it really depends on what is the cause of thrombocytopenia. And with that, we would know whether this would affect the pregnancy itself, and whether or not this person is on any medications for thrombocytopenia as well, because certain medications may affect the pregnancy. So I think if you have thrombocytopenia and you are thinking about getting pregnant, I think it's very important to see a gynecologist or an obstetrician, for pre-pregnancy counseling to find out more about this, so we can optimize your health before you're getting pregnant. Yeah.
Okay, and asking for people that would, after this webinar, will probably have more fertility luck as well. Is there any way, or is there anything we can do to minimize the chance of miscarriage, especially during the first trimester? Is there anything that we should avoid doing or do more of? Anybody? Any doctor? Perhaps.
I have mentioned
I was trying already. I was trying for you.
Yeah. Okay, I have mentioned that I think the miscarriage risk, I think 1 in 5, it's really unknown and it can happen. So is there anything that you can prevent? Of course, that if you do have recurrent miscarriages, and you probably need to find out what's the causes. Usually when we say recurrence, that's 3 or more, then you need to find out what the causes. But if you do have 1 miscarriage, and the chances of you getting pregnant and subsequently actually will be all right, and then you should continue. Yeah.
Right. So there's no such thing as also exercise less, be less active and all that?
Yeah. So I would say that, like you asked earlier, whether strenuous exercise and all that will affect. I would say moderate exercise, but to avoid, of course, if you are pregnant, you should not have a contact sports and all that, like kickboxing and all that. Of course, you should not. But jogging, swimming, there's no evidence that you will affect your pregnancy in terms of miscarriage and all.
Okay, and I think we're going to move on to our last question for tonight. And then I think this question will make a great recap for everyone here, and it recaps tonight very well. When should we start worrying about fertility? Dr. Lily, would you like to take that, or Dr. Serene? Would we all both like to take that together?
I think in general, as I mentioned, the chances of infertility does increase with age. I'm not saying that a woman above 40 or close to 40 is unable to get pregnant, but probably the chances are a bit lower, and it would suggest to get a fertility consult earlier if you're closer to 40. I think probably for most couples on the younger side, after trying for 1 year and not succeeding would probably warrant a fertility consult. Yeah. And if you're older, you'll probably want to seek a doctor's advice a bit earlier.
I mean,
Same answer for you?
yeah, I would agree with that. I think the most important factor that will affect one's chance of fertility is always usually the age of the couple. So the younger you are, the more fertile you are, obviously, because we're all made to have kids when we're younger. You know, our parents had kids when they were 20 something. Now we are delaying pregnancy to the age of, you know, late 30s or 40s. You know, so of course that would affect your fertility. I think certainly if, you know, as a couple, you feel that you're actually ready to embark in a pregnancy together and you're in your mid 30s, I would say it's actually not wrong to seek a gynae's opinion, not only for fertility checkup, but also optimization of your health in general, which is not only important for conception, but important for the actual pregnancy itself. I mean, a lot of my patients just think, I just want to get pregnant, right? But they do not think about after they've gotten pregnant, whether their medical conditions would affect the actual pregnancy itself.
Yep.
And whether their medical conditions will affect the delivery and also affect their, you know, children in the future and all that. So I think take this opportunity, you know, to adopt a healthy lifestyle, exercise, have a great diet, you know, and not only that, we talk about diet, exercise all the time, but the other thing that's very important is also the emotional well-being and the mental well-being of the couple, because getting pregnant is actually very stressful. You know, so I always
Trying
tell,
to get pregnant also quite stressful. You can
yeah, trying to get pregnant is stressful. Being pregnant itself is stressful. After you deliver is also stressful, right?
Life is just
Yeah, I think it's just very stressful. So I just tell my patients most of the time is if they're young and, you know, we've ruled out any other reasons why they have difficulty falling pregnant, just tell them to go and have regular sex and don't stress out about, you know, ovulation kits, you know. I think there was one question that Dr. Chua answered earlier on about, you know, ovulation kit is negative. Does that mean I'm not ovulating? Ovulation kit is positive. So that's why I personally do not get my patients to do ovulation kits, because I think it just adds on to their stress. So just have regular sex.
summarizing tonight's webinar and even last week's webinar. It's actually quite clear to me right now that fertility health basically is just your health. If you keep yourself healthy as much as possible, then your chances will be better, I guess. And of course, age matters as well.
Yeah.
And I guess to answer the question of when do you think you should go for a fertility check, I think it's when do you think you need a health checkup? When you get your first job, you go for a health checkup. I think when you find the one, I think then you go for fertility health checkup. I mean, that's from me, Mr. Chua. Not so much Dr. Chua. And with that, I would like to thank all of you guys for joining us on tonight's panel. Specifically, thank you, or rather namely, thank you, Dr. Tan, Dr. Lily, Dr. Chua, and Dr. Serene for the sharing. If we have not answered your questions here today, we'll try to cover as much as possible on ilovechildren.sg, so please keep a lookout over there. If you will now receive, or you will soon receive, an online feedback form. Do remember to submit the completed feedback form for a chance to receive a Point of Care International goodie bag consisting of 8 ovulation test strips and 2 pregnancy test kits. Once again, terms and conditions apply. Married couples can sign up to receive a fertility health check or TCM fertility consultation by sending in their details to ilovechildren.sg by 30th November 2020. I'm going to say that again. Married couples can sign up to receive a fertility health check or TCM fertility consultation by sending in their details to ilovechildren.sg by 30th October 2020. Terms and conditions apply. This event here is organized by I Love Children and supported by Thomson Fertility Center, Thomson Chinese Medicine, Singapore General Hospital, KK Women's and Children's Hospital, and Asia PR Works in support of Meet for Families. And once again, I'm John. It's been a pleasure hosting this event and on behalf of I Love Children, thank you very much for tuning in. Goodbye and good night. Let's wave. Let me clap for ourselves.